COVID-19 case numbers and hospitalizations in Wisconsin are trending downward, but the stress for healthcare workers isn't going away anytime soon. The state assembly recently passed a bipartisan bill that would make it a felony to threaten a healthcare worker in Wisconsin, and the state Senate is expected to take it up this month. Matt Smith recently talked with Mary Beth Kingston, the chief nursing officer at Aurora Healthcare.
Can you take me inside some of the threats that workers are facing across the region?
Well, we have seen an increase in workplace violence, but I have to say that workplace violence has been an issue in healthcare for a long time. We have had healthcare workers that have been the victims of both physical and physical violence and threats, significant threats where they're really being threatened with bodily harm or that their family members have been threatened. And this is across the country that we see this.
When you look at the violence and threats, what has the pandemic done to those just in terms of the nature of them and the scope?
Yeah. I think during the pandemic, everybody was experiencing additional stress. And, we had to limit visitation, which was very hard for our patients and for our families. That increased anxiety, and we really had to work very hard on communication there. The divisiveness in society over vaccinations and masking, and we have a safe care promise, and we do ask people to mask at this point when coming into our hospitals. And we were beginning to see a fair amount of discord and aggressiveness about individuals that perhaps disagreed with some of those policies.
When you look at the legislation here specifically in the state of Wisconsin that lawmakers are pushing to make it a felony to threaten a healthcare worker, this has pretty wide bipartisan support and is moving quickly.
Yes.
What do you see as the impact of a bill like this?
I think the bill can have an impact in raising awareness and in kind of setting the tone for the behavior and expectations in a healthcare setting. We have to focus on prevention from a variety of viewpoints, whether it's looking at our physical environment. But I think this bill, in raising the penalty for violence against a healthcare worker, is one piece of that puzzle, an important piece.
When you look at the larger issue of recruiting and retaining talent and healthcare workers, how do you do that in the long term to promote more people to get into this profession as we sit here in this day and age?
Yeah, it has been a stressful time, but it's also been a time where, I'm a nurse, so I speak to nursing, but where nurses and others have just risen to the occasion. And connecting to that purpose of why we went into healthcare is paramount. People really, we say this all the time, but people go into this because they care about people and they want to make a difference. And that connection with people and with patients is what draws people to the profession. The unbelievable work that people have done stepping up during the pandemic is just a great example of that.
Up next, a split state Supreme Court.